Assalamu alaikum doctors. In this video I am discussing Turner syndrome clinical station. It very frequently come. First of all, we do the general observation vitals maneuver. Put your hand front of you, we find hyperconvex nail. Make a fist, we find short fourth and fifth metacarpal bone. Make a star, we find short and fourth and fifth fingers. Put your hand in front of your and together symmetrical. Put your hand on your thigh normal. Put your hand beside you cubitus valgus wide carrying angle. Flex your elbows and touch the shoulders with your thumb normal. Back and back to of the neck. Low hairline, waved neck we find, low CTR. Targeted general examination after doing the maneuver. Pulse we check, there is 3D weak pulse, delayed radiofemoral permissions, delayed radial. Okay. Axilla, delayed puberty, no axillary hair. Head and neck, there is high arched palate and goiter or not. Chest, we find scar of heart surgery, shield chest, widely spaced nipples, hypoplastic nipples, capsulate spots. Then back we find low hairline, low set ears, short wave neck. Auscultation, murmur of coarctation of aorta. I would like to complete my examination by measuring the forelimb blood pressures. I would like to ask the mother about the history of lower limb edema in the neonatal period, special school, hearing assessment and having hearing aids. So we are completing the examination by measuring forelimb blood pressures and ask the mother about the history of lower limb edema at the neonatal period, special school, learning assessment or having hearing aids. Management plan of coarctation Turner syndrome is that first of all history I would like to take a full history. Then I will run some test. Investigation diagnostic is karyotype 45XO. Then lab thyroid function test, random blood sugar, sex hormone. We find increase FSH decrease, and LH, decrease of estrogen, that is hypergonadotropic hypogonadism. And autoimmune disease screening, celiac disease, inflammatory bowel disease, diabetes mellitus and vitiligo. Imaging we are doing echocardiography, bicuspid aortic valve, coarctation of aorta, abdominal pelvic ultrasound, horseshoe shaped kidney and stick ovaries, ultrasound of the neck goiter. Hearing assessment for glue ear. We advise the Turner syndrome cardiac advice. Multidisciplinary team for Turner syndrome I am involving genetic cardiologist, nephrologist, ENT for sensorineural hearing loss, SALT, speech and language therapist, ophthalmology, dietitian in GIT for celiac disease, endocrine for diabetes mellitus, hypothyroidism, growth hormone for short stature, estrogen for secondary sexual characters, liaison with the school, bullying and learning difficulty, educational, psychologist, psychological support to the family. Endocrine problem, Turner syndrome, short stature, delayed puberty, hypothyroidism and type 2 diabetes mellitus. Treatment we are giving growth hormone and estrogen. Okay. So presentation is like that. Suppose today I examine Sarah. Sarah is a 14-year-old girl. She was well communicating to me. During my examination, I noticed that some unusual features during my examination in the form of low set ears, waved neck, low posterior hairline. She is short below the 0.4th centile. She is proportionately short. Also in inspection, I see that wide space nipples, shield chest, along with 3D pulse due to maybe coarctation of aorta, wide carrying angle. Putting all this together, I see it is a case of Turner syndrome. In her hand, she has hyperconvex nail and short fourth and fifth metacarpal, wide carrying angle, ejection systolic murmur. Lower limb examination is unremarkable. So this is presentation of Turner syndrome. What are the complications of Turner syndrome? Are in heart we find bicuspid aortic valve and coarctation of aorta, renal horseshoe shaped kidney, GIT, celiac, inflammatory bowel disease, endocrine hypothyroidism, ovarian agenesis, hearing, chronic suppurative otitis media and sensory hearing loss, malignancy we find gonadoblastoma. Screening are all echo, renal ultrasound, audiology, spine x-ray, pubertal assessment. 0 to 4 year we do the hip examination for DDH and ophthalmology. 4 to 10 year thyroid function test, celiac screening and orthodontic evaluations. More than 10 years, we find thyroid function test, celiac screening, ovarian function evaluations, random blood sugar, liver function test, renal function test, and DEXA scan. From Turner syndrome, they ask about the Turner staging. Turner staging are pubic hair, male and female both. P1, there is no pubic hair. P2 is small amount of long downy hair that is fine has over the labia or base of the pubis. P3, adult type of area confined to the pubis. P4 is that adult type of distributions but not extend into the thigh. And P5 is hair extends to the medial thigh. So we understand P1, P2, P3, P4, P5. P1 has no pubic hair, P2 but small on the labia, P3 adult but confined to the pubis, P4 adult but small amount, P5 fully adult. Now axillary hair A1, A2, A3. Axillary A1 no axillary hair. A2 hair present but not adult amount. A3 is adult amount. Now tenor stage in breast development B1 prepubertal, B2 only breast budding, B3 development of the breast mound. B4 is areola project at an angle to breast mound. B5 is adult configurations areola and breast in some place, same plane. Then tenor staging for male genitalia. G1 is prepubertal penis. Unstructured length is 2.5 to 6. Testis volume less than auricle 4 ml. G2 is scrotal laxity. No penile enlargement. Normally testicular volume 4 ml. G3 penile lengthening, scrotal texture more adult. G4 penile lengthening and broadening. And G5 is adult genitalia. So G are 5. P1, P2, P3, P4, P5, B1, B2, B3, B4, B5 and A1, A2, A3. And from hand we start Turner syndrome. What are the features we find from hand? Short fourth and fifth metacarpal bones, cubitus valgus, hyperconvex nail, hypoplastic nail, thready pulse and tenor staging. And from head and neck what we find? Low hairline, low set ears, high axed palate, webbed neck and maybe goiter. Chest we find scar for surgery, murmur, widely spaced nipple, hypoplastic nipple, shield chest shape and capulate spot. So this is all about Turner syndrome. Thank you.